I must take this opportunity to thank Dr. Vitull to give me such a platform to address this topic. It is most neglected but very important. How to scroll it? Well, let's have a quick poll. How many of us feel there is little or no correlation, no link between oral health and cardiovascular health? Please put your hands up. Please put your hands up who feel there's no correlation. I presume all of us feel that there is some correlation. So let's see what research has to say. See, I haven't quoted many papers, but I have picked up 3 which I found are covering vastly the parameters which will make us think that there is a link and we have to address that. Here the author used a population for over a period of 3.7 years. This was a median study. The group was divided into 5. Those having no teeth, people having teeth up to 14, 1 to 14, 15 to 20, 20 to 25 or more than 25. And it was found a 6% increased risk of MACE, that is major adverse cardiac event, could happen with just one single tooth loss. And 27% increase where there was no tooth in the mouth as compared to people who had 25 teeth. Individuals with another study, it says individuals with periodontal disease have 2 to 3 times the risk of experiencing a heart attack, stroke, or a severe cardiovascular event. Another study suggests that simple behavioral change in oral hygiene may help prevent future cardiovascular event, and benefit was notable. 19% reduction in people who were just brushing once a day or more as compared to who were not brushing. And regular professional care once a year or more decreased the risk by 14%. That is quite amount. So this is just a diagrammatic correlation tree, but I will first want to discuss with you the structure of the gingiva, because it is here, from here, that the link will start. On one side it is the gums and on the other side it will be the heart, right? So let's see what the gums are. Most prevalently we feel we have teeth in our mouth which crush and the tongue helps to gulp it down. We totally ignore gums. Gums are the structure which forms a pink layer in our mouth around the teeth. It can be divided into free gingiva and attached. Free gingiva forms a cuff around the teeth of different size. That is, on the incisors it's different depth, on the canines it is different, and then molars it is different. It is here that the microbes, bacteria, aerobic and anaerobic, which are housed there normally, and they react with the food left unattended in these areas, which leads to formation of plaque. Plaque is nothing but a soft white layer initially, if we see it. It is just food and the bacteria. These bacteria, they start acting on it, and if this plaque is left unattended in the mouth, it turns into hard tartar. So this would be the hard tartar picture. It leads to periodontitis, and this is gingivitis. Gingivitis is reversible and periodontitis is irreversible but can be controlled. There's a difference. We can't reverse it, but we can stop it. And it is from here that the bacteria that infect the gums and cause gingivitis and periodontitis also travel to blood vessels elsewhere in the body, where they cause blood vessel inflammation and damage. Consequently, infectious bacteria travel through the bloodstream and reach the heart, where they can multiply and produce toxins that can cause life-threatening endocarditis. The infection and inflammation may lead to death of cardiac tissue, which in turn can cause a fatal heart attack. Now, this is the graphic correlation tree. Periodontal plaque causes bacteremia, which affect the platelet activation, oxidative stress, leads to endothelial dysfunction. Another way is it causes inflammation, increase these levels, IL-1, IL-6, TNF-alpha, CRP, again leading to endothelial dysfunction. It can have an immune response also and have molecular mimicry, which again affect the endothelial dysfunction, and ultimately it is the end result is CVD and the heart is affected. So adjuncts required for good oral hygiene. I will cut short the cardiac part because you guys are more aware and more conversant with that. Presuming this, I will just lay more stress on the dental portion. So what are the adjuncts required for good oral hygiene? Now that we have established that there is a link, I can go in details about the link also, but now I presume you have enough knowledge that there is a link. Bacteria increase the permeability of the gums, blood vessels. From there, they travel, common soil theory, they travel to the heart, and their CVD and all the sequelae are affected. So let's see what are the adjuncts required for good oral hygiene which can prevent CVD. It is home care and professional care. Home care में क्या आता है? Brush, floss and mouthwash. Professional care requires scaling, polishing, gum recontouring and alveolar bone remodeling. Home care, brush again can be a long topic, a full seminar can be taken. You guys must not be laying that much of stress on this, but kindly remember, always use flat bristled brush with short head. Why the short head? Because short head can reach all the nooks and corners of your mouth and all the contours of the teeth can be clean. And what should be the technique of brushing? Single surface, multiple technique. It is simple to understand and simple to perform. Each surface of the tooth should be cleaned 5 times. Give a rotatory motion. This is the demo. But I want to open the link. I want to open this link. I would have loved to make my own video, but kindly bear with me and we will see this. Voice bhi de do bachche.
Scrubbing back and forth, which can actually cause tooth wear, gum recession, and sensitivity over time.
You have to scrub the surface.
There's also making wide surface.
I don't agree with the zigzag thing of the bristles. Remember that, please. Always use a flat bristle brush. Place your brush on the surface of the tooth at 45 degrees and go in a circular direction. Give 5 circular motion on one surface. It is to be placed like this at the 45 degrees and round you go. Press a bit, not much. Don't give very much pressure. Just with the light hand, scrub and rotatory motion. Scrub and rotatory motion. If you see, the gum line is round, semicircular. If we are giving this motion, then we clean all the surfaces. There is no possibility of bacteria or no possibility of food remaining on the surface. So we clean all the nooks and corners. This is very important, guys. Please have a close look and clean all the surfaces, all the teeth, all the surfaces, anteriors as well as posteriors. Sometimes we just concentrate on the anteriors thinking that this is the only part visible, but the bacteria are present in the whole of our mouth. So we have to concentrate on all surfaces, lower as well as the upper. So only disagreement with this video here is the type of brush being used. I would not recommend zigzag because as you see, all the bristles are not touching. If you have a flat brush, it will definitely touch all the surfaces. So kindly pick a short-headed, flat-bristled brush. Paste can be any. As we keep changing the soap, the function of the paste is as good as soap. As we keep changing the soaps, we can keep changing the brush. Medicated pastes are only recommended when it is indicated, when you have some dental problem. So mouthwash. Mouthwash is another factor. Mouthwash is never to be used as an adjunct. It is in addition. It should not be the sole thing to control the oral hygiene. It has to be in addition to the brushing, always. And if the spaces are there between the teeth, the flossing is recommended. Don't push the floss with force. Let it glide wherever it goes easily. And the action should be shoe shine. Like we put this piece of cloth and shine our shoes. This is the shoe shine motion which you should give to the floss. In, shoe shine and out. In, shoe shine and out. This is the method with which you should be flossing. So after all this, I would say gum disease is one of the diseases where body is in a continual state of inflammation, and this is a powerful predictor of CVD. My cardiovascular surgeons will agree with this. Gum disease worsens blood pressure and interferes with medication to treat hypertension also. See, it interferes, it increases the blood pressure and interferes with the medication also. So it is very important that we treat all this. Now coming to the end, whether link is direct, indirect or coincidence, a healthy mouth and regime to keep it that way should be our priority. It is good reminder that mouth is an important part of person's entire health. This is reason enough to do what you can to make oral hygiene a priority. A regular visit to dentist is a low risk, low cost venture as compared to cardiac surgery option, and has other benefits even beyond the scope of this seminar. So maintaining oral hygiene is very low cost. There is no reason not to recommend someone to do this. Proper dental hygiene is just one way to lower risk for developing CVD. Stand by for more studies on oral hygiene and overall health. Until then, keep brushing, flossing, and seeing your dentist. Thank you very much.
Thank you, Dr. Parvinder, for enlightening us and stressing that do care for oral health if you want good physical health otherwise. Because this has been implicated now, oral health, in every system of disease, whether it is metabolic or it is cardiac or it is rheumatological, because it is linked to the gut microbiota, and oral cavity is the gateway to, I can say, our health. Thank you very much.
Yes, it is. And I must thank you, Dr. Vitull, for giving me this opportunity to put across to everybody that oral hygiene is the priority. Yes. Thank you.
Participating in a survey also related to oral health and diabetes.
Thank you.